Greetings, everyone. I'm Mary Cannon, the Executive Director at Stonebridge. Hope everyone's doing well. In our efforts to keep you all connected and communicate with you the best that we can, our monthly town hall has commenced. With much support and requests to get back to somewhat of a normal day, we're happy to give you some updates from our Stonebridge team. We're very thankful to Brooke, Robin, and Tara, who have been very instrumental in helping us to come to you. We do miss seeing everyone. However, as of late, I've seen more movement in our community due to some of the reopening plans that have begun. Our plans have been very successful due to your efforts in following our guidelines. So thank you for your patience and your understanding in helping us maintain a safe environment for Stonebridge. I'm going to start with a few things here. You may hear these again, but I'm going to talk about census, reopening plans, some COVID-19 guidelines, the HERO program, our infection survey, and our new member of our team. First, our census right now. As of today, our independent living is at 190 out of 210, which is 90% occupancy, so go Stonebridge. Our assisted living is 35 out of total of 40. Our Taylor Commons is 15 out of 21, and our skilled nursing is 27 out of 50. Regarding our reopening plans, I want to talk to you about. All plans to reopen any group activity are always submitted to our home office leadership for approval. Up to this point, all activities, including the hair salon, are going very well. I'm very happy. We can continue to reopen as each plan succeeds with no negative outcome. And any upcoming plans will now be listed weekly in the Live Well Stonebridge Bulletin. So plans to open up indoor dining are on hold for now. However, we are working on outdoor dining plans. The fitness center is also on hold for now as all gyms are closed in the state of New Jersey. Only outdoor fitness is allowed as per the governor. I'm going to just talk briefly about our COVID-19 guidelines. You may hear about it later again. Just to make sure everybody's doing these properly, we want to make sure we're all wearing our masks correctly. Social distancing of 6 feet and hand sanitizing are crucial for keeping our community safe from developing cases of COVID-19. Activities are being monitored at this time to ensure safety measures are being followed. Temperatures are being taken prior to the activity, as this is one of the primary screening measures we take to identify possible infection of COVID-19. Overall, most everyone is following the guidelines, so thank you. The next is HERO program. Up to the date of May 29th, we've received 60 donations from Stonebridge in the amount of $10,856. Our next on the list is COVID-19 infection control survey. So 2 state surveyors arrived here at Stonebridge on July 2nd and conducted a thorough survey of our skilled unit for infection control. No deficiencies were found. They were very complimentary of our staff. Both surveyors said we were very impressed with your staff at their knowledge of infection control. Lastly, 2021 budget is underway and directors are in process of developing next year's capital and operating budgets for the approval by senior management sometime in September. Lastly, I'm going to be introducing to you the new administrator and assistant executive director. Please join me in welcoming Roberto Muniz. He's our new healthcare administrator, and you'll be seeing him later on in this program. Thank you so much, and it's been a pleasure serving you.
Hello, my name is Roberto Muniz. I'm the new assistant executive director and administrator here at Stonebridge at Montgomery. I'm new to Spring Point, although I'm not new to senior living. I have had experience in hospice, home care, assisted living, and also in skilled nursing. I'm super excited to be part of the Spring Point family. I'm here to help. I look forward to meeting everybody in person when the time is right and when it's safe to do so. And if you see me, please don't be shy. Stop me and say hello. Thank you.
Hi, good morning. So this is Dawn, nurse from the clinic, and I have a couple of updates for the clinic. A lot of this is infection control and COVID related, of course, but there are a couple of things new that we haven't discussed before. The first is to try and review the quarantine requirements that we have currently in independent living, recognizing that those have changed multiple times and may change again. Currently, the quarantine requirements for independent living, if you leave the community but stay in the state of New Jersey, there are 0 quarantine requirements when you return to us. If you leave the state, or if you go to the hospital, or if you spend time in our skilled nursing unit, we require a 14-day quarantine when you return to us. During that time, we ask you really please self-isolate in the apartment. We will come to you every day to check your temperature and your oxygen levels. All hourly aides, private aides who currently work in independent living are now being tested every week for COVID-19. In addition to that, the staff at the clinic, the nurses and the aides who are coming into your apartments are also being tested weekly. If you go up to our skilled nursing or assisted living units, they're also, all of the healthcare and other staff that work in those areas are continuing to be tested weekly. Should you or your loved one here want to get tested for either COVID-19 or for the antibodies for the COVID testing, you can absolutely do so. You just need a prescription from your primary care doctor. Send that to the clinic or bring it to the clinic. We will test you. Results used to come back a lot quicker with a 2 to 3 day turnaround. With the increase of massive numbers of people testing, even LabCorp and the state labs in this area are taking a lot longer, up to 6 days to get those test results back, but we can certainly do it for you. What else do I have? Clinic doctor's appointments. Currently, the clinic is now back fully open again, including routine and annual physicals, and all our specialists who come into the building are now coming in person. That includes the cardiologist, the dermatologist, the audiologist, any psychiatry care that's provided. They're all coming in person. They are, of course, screened when they come in. We sanitize the rooms before and after every visit, and we require mask use for everyone coming into the clinic. Mask use in the building is also mandatory. Please, we're asking you to keep your masks on above the nose and under the chin whenever you come out of the apartment. Obviously in the clinic, but really everywhere in the building. If you do not have a mask, you can always ask for one at the clinic on an emergency basis. The clinic will also be selling masks. So should you wish to purchase masks, please contact the clinic and we will happily accommodate you with the surgical style masks that we have. They're nice and thin for the summer. If you do not have your mask on you, we will ask you to return to the apartment to actually retrieve your mask and then come back out again. Flu shot preparedness. So moving on to a slightly different topic, we are concerned that come the winter, we may see a combination of the continuing viral concerns of COVID on top of the regular annual flu concerns. So even now, we're going to start talking about reminding or encouraging people to please consider getting a flu shot when they come to our community. We will be having a flu shot clinic again this year, probably around the same time we did last year, which is around October. It is strongly recommended for anyone over 65 to get a flu shot. We will not offer the high dose, just a regular dose flu shot, but it will be available here in the building. The very last thing is ground floor visitations. So it's getting very challenging, of course. We've been home for a very long period of time, but we're still asking you, please ask your loved ones to respect staying more than 6 feet away from your patio areas on the ground floor if they're coming, and to scream at the front desk for both symptoms and temperature before any loved ones come to visit you, even outside of the building. And the very last thing we did, so we just did this a couple weeks ago, we had a company called BioProtect actually come and spray an extremely effective antiviral treatment for our entire healthcare area, both floors and certain other public areas in the building. The idea is that this treatment actually will protect against viral contaminants on inanimate surfaces for up to 3 months. It has been extremely successful in our state. Our other sister communities are using it, and Stonebridge had it done already. That is in addition to the sanitizing that we're all doing on routine basis, both in the clinic and other areas in the building. But this new BioProtect system should be an effective addition to our infection control protocols. Thank you very much, and I'll see you again next month.
Hello. Hope you are all well. We miss you all, and hope this all gets over pretty soon. Starting tomorrow, Thursday, we're going to be distributing the menus a little differently. Okay, as you can see, Abdul's putting them all together right now as we speak for all the residents, both here in the clubhouse and for the cottages. We're going to be delivering them, the menus tomorrow, and picking them up on Friday by 1 o'clock, around 1 o'clock. All right. The menus are going to be from Sunday through the following Saturday. So this should alleviate any confusion that anyone's been having. So that'll start tomorrow. You'll get the menus for next week. Please fill them out by Friday, and we'll have them picked up. I also submitted a plan to corporate to reopen for outside seating. We don't know when this is going to take place, but there is a plan submitted. Soon as I find out anything, we'll be distributing a letter and a schedule, everything to you, so you know what's going on. Other than that, I really don't have anything else to say because we don't know what's going on, just like you don't either. So we're just gonna plug along and do our best like we always do, and just let us know if you need anything, and we'll do everything we can to take care of it. Thank you.
Thanks, Ed.